Hey, so you're wondering, do they still take tonsils out from kids? I want to know personally, do they really eat ice cream if they take it out? That's a whole other thing. But we got somebody here actually going to answer it. This is Dr. Bilski. Now, here's a funny thing, though. Dr. Bilski is originally a dentist, but so tell us about what you're doing at your dental practice that has to do with tonsils coming in or out, staying in or out, rather.
Right. Okay. So we get kids coming through all the time, and I'm what's called a general dentist.
Okay.
And we do orthodontics, and we do some Invisalign, and when we get some more, when I say more complex, not complicated, but the child needs a little bit more of a specialty care.
Okay.
Yeah. And it's not just one tooth that's turned a little bit that Invisalign can take care of. And I like to send to Dr. Sullivan, who's right down the street from me, and she takes a look. A lot of times, the first thing that an orthodontist or myself will look at is that airway. Well, what's obstructing the airway? Tonsils.
Okay.
They're back of the throat. So the initial question is like, what are they doing with tonsils anymore? Are they still taking them out?
Yeah.
When I was a kid, they did.
Sure.
Now, you're going to be hard-pressed to find somebody that's going to take tonsils out.
Well, the thing is, they won't, and my kid's got a problem. What do I do?
What do you do? So you got the 7 or 8-year-old, or maybe a 12-year-old that's getting ready for orthodontics that's snoring, and that you can hear it in their voice, and I can't properly imitate it, but it's like they have a cold.
Yeah.
So we have in our office the Photona laser, which is we have the ability to shrink the tissue, shrink the tonsil.
So this a Photona laser is what you're doing. You're aiming it at the tonsil.
Yeah. Well, it's not Star Wars where we're
but it's
burning our initials. No, but it's a light. Yes, it's lower energy, and there's two. There's an end YAG, ND YAG, and an ERB YAG, ERB YAG, and they're two different types of lasers, energy levels, specifically set up at a frequency that works on the tonsils to shrink the tonsils.
And that solves the problem, or helps the problem.
It helps solve the problem.
Wow.
Yeah, it shrinks the tissue.
That's very neat.
Now they have a more clear airway.
Yeah.
And if you think about it, those kids that have that now, well, they're destitute and losing when they're in their 30s. They're going to be snoring like someone's cutting the grass in your backyard. It is loud.
So that's a way you can actually get ahead of that for your kids. That's something I've never even thought of.
That's another topic that we'll go into a little bit later, but sleep apnea. But back to the kids, we're not fitting kids for appliances or masks,
right?
CPAPs or BiPAPs. What we're trying to do is have ENT specialty people look at them and then determine, like, how severe is this? Do they need any surgical intervention? And most of the time, it's not a good thing to do with these young children. So why not try to shrink these?
That's really amazing. And now it can happen. I mean, so if you've got a kid who's got a problem and you're not sure about tonsils as they come out, your dentist, or at least this dentist right here, Dr. Bilski, may be able to help. I have one more question about the whole thing. So after you do shrink the tonsils, do you give ice cream to the patients?
Ice cream is for winners only.
Okay, all right.
So if you do it, yes, we have tickets that we give out, and they get fun stuff.
All right.
But here's the other thing too, to really touch base here. You're going to shrink my kids' tonsils. How are you going to do that with the laser? That's got to hurt. No, it doesn't hurt. That's the interesting part of it. It does not hurt.
Wow.
So it's a non-novocaine, non-cutting, non-ablative. It just shrinks that tissue.
And I got to think a kid is thinking, this is cool. What? You're going to aim that?
Yeah. So you do have to have a few appointments. So it's usually 3 appointments, and it's spaced out every month.
Okay.
So rather quickly, within 2 months, if you come at the first of the month, the end of the month, and one more month later, if you had 3 appointments,
it's pretty neat.
Yeah, for the younger people, it's going to work better. Now, older people that may have enlarged tonsils that only have like a postural snoring, that's when we get back in the CPAP, BiPAP type thing with sleep apnea. It might be a little bit more like if you're 50. Yeah. So Randy's going to need 5. But we minimally do 3, see how you're doing.
Okay.
And if we see some resolve, then we'll talk a little bit more about what has to happen.
Well, you know what? We've got another video just about that. So if you're not already at the website, you should head there, bilskidental.com. You can learn more about how to get past this tonsil or deal with this tonsil thing. But you can also find out if you got a snorer in your family or is wearing that little mask right now, how to take care of that. BilskiDental.com. Check it out right now.